All right. So welcome everyone to Reimagining Prevention Using Hope to Strengthen Substance Use Programming. We are so happy to be here with you today and talk a little bit about this topic. So just to introduce ourselves, my name is Amie Myrick. My pronouns are she, her. I am the Director of Evaluation and Quality Improvement at the Hope National Resource Center. Before that, I was also a Hope facilitator and champion. So I've been involved with the Hope framework for a number of years now. Prior to this, I worked alongside Camille, who will introduce herself in just a moment, at the National Association for County and City Health Officials, or NACCHO. And there we did a lot of really wonderful work together, primarily at the intersection of adverse childhood experiences and substance use. And then we also did some work looking at ACEs, substance use, and suicidality, and shared risk and protective factors there. I also am a licensed clinician in the state of Maryland, and so I've done some work in substance use treatment, kind of boots on the ground work. I worked for a number of years at an outpatient methadone clinic. I also continue to have a small practice where I do some work with substance use within my work of trauma. And then something else that I think is really important whenever we're doing hope-based work is just to kind of think about all of the ways that we are leaning into these building blocks of hope. And so recently, after 6 years of reading the Harry Potter series together, my son and I finally finished it, which was very exciting. I had never read it, and so we enjoyed that together. And really just leaned into that relationship and engagement building block because we were kind of part of this little book club that we had going. And so I'm going to go ahead and turn it over to Camille to introduce herself.
Thanks, Amie. Hi, all. Welcome. My name is Camille Adams. I use she, her pronouns, and I'm really happy to see folks on the call today. I'm a senior program analyst at NACCHO, as Amie shared. That is the National Association of County and City Health Officials. And just a bit about NACCHO, we're a nonprofit membership organization, and we serve the over 3,300 local health departments across the country through policy development and advocacy. We develop and offer tools, resources, trainings, and funding for local health departments and their partners, and provide technical assistance. I am, as Amie mentioned, on the overdose, injury, and violence prevention team at NACCHO, where I lead and support projects that really aim to strengthen local health departments and their partners' capacity to prevent ACEs, to prevent suicide, to prevent overdose, and to apply a shared risk and protective factors approach whenever they can. And I became a HOPE facilitator in 2024, and just 2 months ago finished the HOPE champion training, which I'm really excited to have under my belt this year and to bring to all the project work that we do. Prior to joining NACCHO, I was an active clinician. I was a behavioral health specialist at a federally qualified health center, where among my many roles, I worked on a multidisciplinary team that launched our medications for opioid use disorder program in the clinic. I am a licensed clinical social worker. And while I'm not currently practicing in the clinical space, really value that experience and what it brings to the public health field. So when it comes to the building blocks, I have been volunteering a couple times a month at a community farm down the street. This farm is 100% volunteer-led, and all the food grown on the farm is free and available to the neighborhood and the community. And having this engagement in my life is one of the things that's giving me a sense of connection and purpose right now.
Love that. Thanks, Camille. All right. And so we are going to jump right in to what we're hoping to cover today. And what that is really to understand what hope-informed substance use prevention looks like in practice, to talk about some strategies, resources, and tools for applying hope within your prevention programs. and to collaborate on ideas for hope-informed substance use prevention efforts. One of the things that Camille and I talked a lot about when we were preparing this session was just how much knowledge there is in the room, certainly beyond what she and I can share. And so we're going to share our thoughts and our experiences, but we certainly do want to hear from you in the chat while we're sharing. And then we do plan to have a short breakout to give you an opportunity to talk with one another. And so we wanted to start by just connecting the dots a little bit on positive childhood experiences and harms associated with substance use. And so one way to conceptualize this is to first think about how ACEs, or adverse childhood experiences, increase risk for substance use. And so what we know is that an adverse experience happens, and certainly it can happen in childhood, but it could also happen in adulthood. And it increases risk for substance use. We know that when someone experiences a potentially traumatic event, they may have trauma-related symptoms, and we know that different substances might help alleviate those symptoms. So for example, for some people who feel very intrusive, hypervigilant, anxiety-based symptoms following trauma, they may find that medication helps kind of quiet or calm that. For people who experience numbness or dissociation, sometimes they find that substances help them feel something. So kind of getting back, some of that feeling when they're feeling too little. And so we know that if trauma increases the risk for substance use, substances and substance use can progress to a substance use disorder, and can certainly lead to, overdose, among lots of other negative health outcomes. It also can lead to higher risk for additional victimization, so re-victimization or additional violence. And so with that then comes an increased risk of those trauma-related symptoms and potentially more substance use, right? So you can see how that cycle, might play out. And certainly the etiology of substance use disorders is really complex. This is not the only potential pathway that links ACEs and risk for substance use disorder together, but it's just one kind of relatively straightforward way to think about it. And so how this relates to PCEs is that we know that positive childhood experiences have the power to impact mental health symptoms. And we also know that for people who have higher reported positive childhood experiences in their life, they're less likely, they have a lower lifetime odds risk of using substances ever. And so we know that that's true of illicit substances. We know that they're less likely to struggle with alcohol use or cigarette smoking. And so PCEs are really, really powerful experiences, right? ACEs are not the only impactful experience that people have kind of across the lifespan. And so if we know that PCEs have the power to reduce mental health symptoms or improve mental health overall, then another way to think about that is that positive childhood experiences could help break this cycle where trauma leads to symptoms, leads to self-medication, leads to increased risk, leads to more trauma, and so on. And so if we can understand and leverage and increase access to positive childhood experiences in the families that we work with, then, especially families who might be impacted by substance use, then we have a really powerful, kind of tool in our toolbox. Another way to think about ACEs and PCEs and kind of how they connect is that ACEs can also block access to PCEs or complicate them. This might be particularly true when substance use is in the mix, right? So if a family is struggling with substance use, which we know that, a lot of the families that we work with who are involved in the child welfare system may also struggle with substance use. And so for some of those systems involved families, the substance use and the resulting child abuse or neglect is really getting in the way of that relationship building block, right? It's getting in the way of the safe environment building block. We know that, adverse community environments reduce engagement. We know that that makes it harder to feel a sense of mattering or safety in your community. We know that if, children are around adults who are struggling with substance use, they may not be learning what we want them to be learning in terms of the emotional growth building block. And so again, PCEs are just a way to think about not only, increasing the likelihood of some of those positive outcomes that we know that come from PCEs, but also really kind of handling or managing these ACEs, which can block access to some of those positive experiences. And so over the past several years, NACCHO has partnered with the Centers for Disease Control and Prevention and the Hope National Resource Center to support local health departments and their partners and their communities to think about programming that addresses the intersection, not just of ACEs and substance use, but also putting PCEs in the mix, right? So finding ways to disrupt that cycle, to prevent ACEs, to intervene when ACEs do occur, and really promote access to PCEs and decrease risk of substance use. And so, you might be kind of thinking, well, how did we decide on HOPE, right? Why HOPE? And so, HOPE is a really powerful framework. We all know that. That's why we're all here at the summit for the next couple of days. But when we think specifically about systems involved families or families who are impacted by substance use, HOPE gives us an opportunity to build trust with these families. It gives us an opportunity to interact with them in a way that reduces that power imbalance, that power over. For a lot of these families, they're very used to being told all the things that are wrong with them, right? And all of the things they have to do to be able to stay in relationship with their children, to be able to keep their home and their job and all of these different things. And so HOPE really reduces that power imbalance by working with people to understand, what's getting in the way and what is most important to them in terms of these building blocks. HOPE respects and engages clients and consumer voice in programming, which is really important when we're trying to create programs that are actually going to help, right? Offering a program in a community that nobody's willing to come to, that has no relevancy to what's facing the families in that community, and that isn't effective is not, a great use of time or resources. And so when we can reduce that power imbalance and we can build that trust, it also helps us engage the people we really need to hear from in the community, which is these families and is these individuals who we're trying to support with these programs. One of the other things that's really nice about the HOPE framework is that it acknowledges the impact of substance use, right? So HOPE is not about ignoring the challenges. It's about kind of linking together our understanding of the challenges and how we can leverage strengths and how we can promote access to positive experiences. And so it really takes it all into account. And I think that holistic approach is really important and helpful for these families. The HOPE framework creates access to PCEs to help break some of the cycles that some of our families find themselves in. And again, just really empower those strengths, empower those families to use those strengths and name those strengths. As I'm sure other people in this summit are talking about, the HOPE framework and this strengths-based approach for some families might be the first time that anyone's ever really acknowledged some of these things as strengths and as these things worth getting to know and understand and utilize. Another thing that is important is that the HOPE framework assumes that even if a person is actively using drugs, they can still love and value and protect their children and their family. In the HOPE substance use prevention, intervention, and treatment training that you can access on the HOPE website, there's an example of a program that focused on public restrooms. And they focused on restrooms where they knew that people were using drugs, and they put overdose prevention kits and messages acknowledging that people who were using drugs with families might be coming in there so that they don't use in front of their children. And so really they were trying to highlight that a person who is actively using substances can still value their children and want to do best by their children. And so, those types of messages might, make the person more likely to use harm reduction strategies. They might, make the person more likely to tell somebody, what's going on rather than just the shame that comes with using and the isolation that comes with it. And so, it's just one of those really great examples of how you can kind of hold both, right? You can say, hey, this person is, using substances. We want to make sure they're doing that safely from a harm reduction standpoint. And we want to recognize that, they might be factoring their family and what they believe is best for them in those moments as well.
So what are really the main components of a hope-informed substance use program? And we can share a few things here. We'll go into some more detail later about what this might look like in practice. But substance use programming may mean, as Amie mentioned, harm reduction programming, treatment programs, or prevention programs that prevent the harms associated with substance use, which we know can include substance use disorder, overdose, adolescent substance use. And that space traditionally focuses on deficits. And it makes sense, particularly when it comes to treatment for substance use disorders. People are coming in contact with services at a moment of need, where they face a challenge and they may need support, or may have received a lot of messaging from people in their life or systems that there's a lot to fix. But treatment providers, in that setting, you want to understand the problem so that you can make sure that the best, most appropriate treatment is offered. But applying the HOPE framework to treatment means seeking a balance so that there's an understanding of a person's strengths. And that is just as important as understanding what those challenges are. And this is really rooted in the recognition that people who do use drugs, as Amie mentioned, whether they ever seek treatment or not, have unique strengths that can and should be a part of the conversation in prevention programming. And so this may look like incorporating assessments of strengths, assessments of assets or resources into your program intake process or your treatment planning process. And we'll talk a bit more about those examples in a bit. A hope-informed approach also really centers on that continuous process improvement. This means consistently eliciting input and feedback from your program participants and the community at large, depending on what services you offer. So for example, if you have a local harm reduction vending machine, you might incorporate a QR code at the site, linking folks who use the vending machine to a survey with some questions about, their experience accessing the vending machine, what supplies they would like to see added, or recommendations for other vending machine locations. That way you're using the input for improvement, but also for development of new programs, services, supports, and resources. And if any changes are made to your services or programs as a result of input from your participants, you also want to make sure that you can close the loop and communicate what feedback was received and what you've done to address it, so that the program participants in your community understand how you're appreciating and integrating their voice and experience into your services. Finally, we know that people who access substance use services or prevention programming, they don't live in a vacuum. Program participants might be parents, they might be caregivers, or you may be working with youth who have siblings, parents, or caregivers at home. And so hope-informed programming recognizes this, and whenever possible, it promotes access to the 4 building blocks, which of course are relationships, environment, engagement, and emotional growth. And some programming is just designed with families in mind. For example, Amie and I at NACHO both worked with an organization called Gaudenzia, and this is a substance use and co-occurring disorder treatment provider in the Northeast region. They have a program specifically for parenting and pregnant women. And that program is really designed to support family unity, allowing mothers to keep their children with them throughout the treatment journey. So you can conceptualize how many building blocks are available to the children who are joining their parents in that experience. Their treatment options include residential treatment for the parenting women with on-site childcare, support for support services for children, making sure that they have access to safe environments and those emotional growth skills that we know are necessary for children. And as a part of our work with that site in particular, they also started offering the Circle of Security passes to their parenting women in the program. And that's a program that helps caregivers really connect with the children in their lives and provide some parenting skills training and support among parents. So by really incorporating this into their very intersectional program, they're demonstrating to their clients that their experience as a whole person, including their role as parents and caregivers, isn't something entirely separate from their needs in substance use treatment. So that's an example of a program that really integrates by design, both looking at the intersection of ACEs and substance use and also promoting lots of building blocks for the families involved. But there may be opportunities for programs that aren't specifically designed in this way to reach out to the community and understand what opportunities for access to building blocks already exist and make sure that the program participants know about them. So there's a lot that you might be able to promote access to the building blocks depending on what kind of program or service that you are offering to the community. Okay, so we are hoping to hear from you all now as you're thinking about the programming that you may be a part of or know of in your community. Where do you see strengths or gaps in how current substance use programming addresses strengths or addresses resilience? So we're looking for strengths or gaps. And we'll give folks a moment if you're typing. All right. So a couple things coming in. Gaps, programs not communicating, kind of in silo, need to build community partnerships, new programs and programs we are unaware of. Yeah, absolutely. Thanks, Sandy. That sort of siloing in the community of different programming and then not being aware of what's available to folks can make connecting families very difficult. Strength is striving for meeting the individual where they are. Yeah. Thanks, Katie. We are in the process of adding in hope-based questions on intake form in our FRC's partnership to SUD programs. Thanks, Jade. Yeah, that's fantastic. I've heard from a lot of sites that this is one of the things that they're focusing on right away is how can we sort of formalize asking these types of questions in our programming.
Yeah. And, just to kind of add to that, I think even just the way in which we ask questions, right? I think, sometimes we ask questions and whether we intend to or not, the way in which they're worded or the way in which the responses are there kind of implies that there's a right or a wrong answer or there's a preferred answer or there's a less than optimal answer, and so I think really being thoughtful about, just understanding how a population who has struggled with substance use, just the shame and the judgment that they often feel. And so just doing what you can to kind of, come up with questions or statements that encourage sharing that, really any answer is an okay answer, which I think it sounds great in theory, but it's harder sometimes when you're actually putting those questions together. So appreciate that.
Yeah, I agree. And also coming back to it later. So not just asking and leaving that information hanging for the rest of your engagement with that person or that family, but making sure that you circle back to it. I love that.
Mm-hmm. Yeah, Miriam, thanks. An area for improvement. I think we traditionally have rigid notions around engagement and perhaps unrealistic expectations in our interventions and even in our prevention frameworks. Absolutely. What is reasonable and what what does engagement, what types of engagement are we looking for people to get the most out of, our programs? And sometimes we've got, again, kind of this ideal, everybody participates in everything, but really, if that's not realistic, for the communities you're working with, one, does the program have to be set up that way? And two, what else could you do if some of those areas or some of those goals aren't feasible? Thank you for that. Susan said she works in media and comms for tobacco control. Historically, it's always had more of a shaming effect. Absolutely. Making folks feel guilty for their behaviors. Guilty as parents who smoke around children. Absolutely, Susan. I'm so glad you brought that up. In general, the research does not support the scare tactic way of getting people to stop undesired behaviors. Actually, what the research really kind of speaks to is that positive social norms really help instead. So saying, speaking to, healthy ways to keep your child safe and engaged, and focusing on, who's not smoking, who's not doing different things, instead of kind of focusing on all of the problems, really looking at what families, could be doing more of, or celebrating what they already are doing versus just kind of, shaming them for the behaviors they may be engaging in. Circle of security parenting, funding, placing family with the right supports. Most schools in Minnesota, most schools send kids home for breaking substance use policies instead of providing education and building their resilience. They get separated from their friends, activities, and teachers. Such a great point, Jason. I think so often people do things wrong, right? And we just take away all of the things that are really more of what we want them doing instead. And then we're surprised when they keep doing the thing we don't want them to be doing, but we've kind of taken away everything else, right? So such a great point.
Gaps, parents' involvement in programs that is outside of legal social system when presenting social development strategies. Yeah, I've heard that involvement across the board is something that, I think all of us are hoping for more of at any possible time, and that it's challenging, when parents, especially those who are connected to any type of system and may have a lot going on, to get them present for certain activities that you're hoping for.
One of the other ones that I wanted to just kind of uplift before we move on is there's a comment that pro officers are not strengths-based at all. The women I work with get so discouraged, especially my postpartum mamas. I think that's so true. When I was working, the clinic that I worked in was a floor above Center for Addiction and Pregnancy. Not my favorite name, but that was the name of the center. And but they were working with women who were pregnant or recently postpartum. And that group is just kind of a next level of, so you've got all of the challenges of, just the shaming and difficult pressures we put on families and parents. And then the added piece of, potential systems involvement or substance use history. It can be really, really challenging. Especially when those families, when those parents are working really hard to get their kids what they need, or they're getting to appointments and then they're getting there and they're, and I mean, if it were me, I'd be like, why did I do all this work to get here just to be told all the things I'm doing wrong? Mm-hmm. So thank you all so much. We're going to give lots of opportunities for sharing. Really appreciate everybody's thoughtfulness for that question. And so, kind of a next question related to that. And some of you have already started sharing some of it, which is great. So we'll just kind of continue on this. As we're talking about some of these challenges and ways that we want to get strengths in there more often, what are you currently doing in your work that aligns with hope-informed practices? And you might not be calling it hope. Again, we talk a lot about how the hope framework is not about throwing out what you've been doing and starting over again. A lot of times people see pieces of what they're already doing in the framework, which I think is really beautiful. And so again, some of you have already started doing sharing some of this in the chat, but just want to ask more explicitly. And while people are typing, one of the things that I saw was that in response to the whole idea of kids getting sent home, there's been a push in one person's community to really find alternatives to that suspension, which I think is great, right? That would be a hope-informed practice. It would be about keeping people engaged, keeping kids, getting access to skills to learn that emotional regulation strategy that might prevent them from using substances in the future.
If I may, we live in a very socioeconomically depressed area and have actually are building a community resource center called Hope Hub. And we currently have 3 of Hope facilitators in our county and have more in getting ready to begin training. So we're really embracing the idea of hope.
That's amazing.
Wonderful. Just wanted to note, Camille, a couple people put in the questions, some in the question section, some responses. So I wanted to just note those as well. Someone mentioned that we're the only program in our valley with long-term inpatient treatment with their children living with them. So more of that would be great. Good follow-up, putting families with the right programs. Just wanted to make sure that their comments were included as well.
Perfect. Okay, Sandy says we got a grant for Smart Room and trained some behavioral health providers in smart therapy. It is a very trauma-informed care approach and focuses on strengths and accomplishments. Amazing.
Fantastic. Wonderful. All right. All right. So as we're talking, feel free to keep adding as you come up with ideas or thoughts. Like I said, we'll pause a couple different times with some specific prompts, but don't hesitate to share.
Thank you all. Yeah, really love seeing these. So as Amie mentioned, we worked together at NACHO for several years, and Amie is really responsible in a large way for bringing the HOPE framework into NACHO's project work. So I also just want to take a moment to say, if you are recently trained as a champion and you're, the one that's coming to your organization or your agency with this information, there's so many ways that seed can bloom. And so I want to talk a little bit about some of the projects over the past few years that we worked on together and one that's happening currently. So these projects are with the support from the CDC, and we've really focused on the intersection of substance use, overdose, and adverse childhood experiences, beginning with a project that we call CCAPS from 2020 to 2023, where NACHO and CDC supported 16 community-based organizations and local health departments with some technical assistance and funding so that they can implement or expand programs that both prevent substance use disorder and overdose, but also have the potential to simultaneously prevent ACEs. I was describing that program in a previous slide, who was a part of this cohort. And so the program was called Comprehensive Community Approaches to Preventing Substance Use. And so at this point, we had not intentionally brought in the HOPE framework specifically. And we learned from this project that a lot of the ACEs prevention work that sites are doing, great work around the country, centered on some of the strategies outlined in CDC's ACEs prevention technical package. And they included aspects of promoting positive childhood experiences, but oftentimes there was, sites were sharing with us that they wish they had a consistent message. They wish they had a consistent language or framework by which they're communicating about PCE promotion to the community. And so this kind of inspired, along with having Amie's access to her HOPE training, looking more directly into how we can support communities to implement the HOPE framework in various settings. We moved on to a project called the Strengthening Systems Involved Families with HOPE Project, or SSIF. And for this project, we were able to directly work with the HOPE National Resource Center and the Strengthening Families program to bring those 2 frameworks to 4 local health departments who were partnered with child welfare or justice system partners. And so we really wanted to focus on supporting those groups to align their work with families who might be involved with a system of some kind in the community. And we had a broad definition for that. And this was a great experience because we were able to really look at, or the Hope National Resource Center helped us to look at how complementary the Strengthening Families Protective Factors are with the Hope framework. One focusing, the Hope framework focusing largely on protective factors for children, and Strengthening Families focusing largely on protective factors for parents and caregivers. And there's a ton of overlap there. And so these project teams completed an organizational self-assessment. They looked at their organization. They identified some opportunities to integrate more of a strengths-based framework into their existing work. And then they set up an action plan to get started with implementation. And right now, over at NACCHO, we're in the middle of a project called SPARK. Sparks, we love acronyms at NACCHO. SPARK stands for Substance Use Prevention, Adverse Childhood Experiences Reduction, and Capacity Building. And it's a planning grant where the participants, who are community-based organizations across the country, receive their Hope 101 training. And they also work with us to look at where they can integrate some more strengths-based or resilience-based approaches into the work that they are doing. And they're developing some action plans to do that. And these sites, there are 6 of them, work with families impacted by substance use or by particular systems in their community. And so, again, all this work sort of iterating over time to what it is now, where we're really aiming to help communities shift from a deficit-based model to a strengths-based model. Okay, so what have we learned specifically from some of the folks that we have worked with or are working with, and how can you get started in integrating the HOPE framework into your substance use programming? As we saw in the chat and the Q&A, many of you are already implementing a lot of those elements that we talked about earlier, but we have some additional ideas here that have bubbled up out of work with these project sites, and are excited to hear from you further in a little bit. So first, inquire how aligned your team already feels with strengths-based approaches and the HOPE framework specifically. And I do recommend that you find a way to ask your staff. Maybe that's in regular supervision or through an anonymous survey, but definitely ask. You may have the sense that your organization is already aligned with the components that we reviewed earlier, and that may very well be true. But you may also learn something new by getting questions answered from your staff about how aligned they are actually feeling with these approaches. So one of the sites I've worked with, and this kind of speaks to something Amie was mentioning earlier about asking more strengths-based questions in an intake process. One of the sites I worked with, has a lot of integration already with strengths-based approaches in their substance use treatment services. And we kind of dug a little bit deeper into their intake process and understood that, they have a lot of required assessments to do, like following the ASAM criteria, which is a very lengthy process for intaking clients. And yes, they did have a question in their intake process about strengths, but we learned from conversation together that staff really found that the way this question was worded often confused clients, or clients didn't quite know how to answer, how they should answer. And staff felt it typically didn't yield a lot of information for them or open a door to discussion. So even though they did ask about strengths, by talking together more as a team, they decided that maybe there are other ways to better engage clients or support staff in asking questions, so that there can be a more robust conversation in the intake process about the client's strengths. So they're working on that, which is a nice segue into that second bullet point, reviewing your forms, like intake forms, and your policies. In the SSIF project from last year, maybe 2 years ago. One local health department worked regularly with the county community justice office that handles their pretrial services, juvenile and adult probation, and diversion. And a representative from the county community justice office participated in the project alongside the local health department staff. And as a result, that person decided to set a goal to review a specific policy in their community justice office. And to make sure that their goal was feasible, they started with one policy. There's a lot of policies specifically when you're talking about organizations, similar to community justice or child welfare. So they picked one policy that was focused on engaging and involving families. And they selected this policy because it was already due for review anyway, per the state guidelines by the end of the year. So this was an opportune moment. And their plan was to review that policy, determine how it promotes any of the 4 building blocks, and or where it might create a barrier to any of the 4 building blocks, and come up with some recommendations for adjusting or editing that policy. So, starting small with one policy, I think, was a really great idea and way to make sure that you're keeping things feasible. Consider your program space. So this is where you're imagining what it's like to be a client, what it's like to be a participant in this space. If families with children come into this space, do you have engaging activities for a wide age range available? What's on your walls? What handouts do you have available? Do these focus on deficits only, or are they kind of scary? Sometimes when you go into family spaces, there's a lot of big red exclamation points, and understandably there needs to be information on risks, but where is the balance? And I know one site that I've worked with in the past that operates family resource centers for parents and caregivers, and they recognize that they could really work on that physical drop-in space to include more information about positive childhood experiences, about strengths, on the walls and in whatever handouts that are available for folks to pick up in the office. And they're also considering partnering with an organization that provides services to children, so that potentially that organization can come into the Family Drop-In Center and offer some programming for children. So they were able to consider, how can we get more building blocks available through this drop-in center, and look for a partnership that might be able to help them do that, which I think is really exciting. So engaging meaningfully with clients, participants, and staff on what they see as opportunities related to the 4 building blocks. One great way to do this is to have a patient or client or community advisory committee that regularly provides input and feedback on your programs or services. But you might also ask clients or participants just as a regular part of your interactions with them, or make sure that you have a feedback box, whatever it is, that creates space for the people you're working with and for to share what they see as opportunities related to the 4 building blocks. So, moving on to the training aspect. Of course,
actually, Camille, before you do that, just a thought that I don't want to lose.
Sure. I know I'm going, I would love your thought, please.
Yeah. So one thing that I have found, or one thing I would just encourage you all, if you're doing this work, to think about, is to take a strengths-based approach to your own work as well. And so I think it's really easy when you start looking at forms and policies and your waiting room and all these different things, to just see all the things that aren't hope informed or aren't as hope informed as they could be, or things you don't like. And so one of the ways when I've worked with groups, one of the ways that I've really encouraged people to think about it is, what are you already doing really well? What do you think is a strength? What do you think is well aligned? Where do you think there are opportunities to be more aligned? And how do you feel when you do this form? How do you feel when you walk into this room? How do you want people to feel? And I think even when you're asking for feedback from people, if you have a suggestion box, I would encourage you to really encourage people to put the things they like too, because then you know what people want more of or what already feels right. I think sometimes we focus so much on redoing things that we don't give ourselves kind of permission to celebrate or to own what we've done a really good job of. And look, sometimes we like fall into that, right? Sometimes that's by accident, but I think sometimes it is very intentional, even if you didn't call it hope. It might have been related to one family that, after something happened, you all were like, we got to do this different. And you did, so just keeping in mind, taking a hope informed approach to your own work, as well as kind of, thinking about how you can make things, better. And then Camille, the other thing I wanted to just let you know, we don't have to answer it right this moment, but there was a question in the chat about applying this to those returning from incarceration. So maybe just something we can tie together after we get through, this slide.
Great. Yeah, that's a great question. Thanks, Amie. Yeah, and to that point, Amie, I know a group who, they were already planning to develop a patient advisory committee, but now they really want to incorporate how can we start off every meeting by asking what's going well, and make sure that question is top of mind. Okay, one good starting point, as we know, is to provide Hope 101 training to all staff. And this really helps to create that shared language among your team and sets the foundation for working together so that you can integrate, what's learned from that training into your programs and services. And I would suggest considering not just training, but maybe facilitating regular follow-ups, perhaps a 1 and 3 month follow-ups with the staff that you've trained to see how they're integrating what they've learned. Maybe they can share about where they might need more support or what gaps are emerging, and then strategize together around moving ahead with aligning what your programs and services are with the HOPE framework that they learned about in the training. So I love, we have a few folks doing that, and I think that's a great way to make sure that it continues to feel relevant to the staff and that there's conversation about how it's going once they've learned the information from the HOPE 101 training. And I would encourage you not just to train clinical staff, but everyone, administrative staff, leadership, volunteers, all folks in the program. Yeah, and you were going to add something?
Yeah, I was just going to say, for those of you who are facilitators or are working with facilitators, one of my favorite ways to really encourage that practice change is just to ask people before the end of the training, what's one small thing they're going to start doing differently. And sometimes, Camille knows this from doing enough trainings and facilitations with me, I'll often add, without additional resource or authority, not something that you have to get a grant to make happen, not something that you'd have to get approval from 6 people to do, but just something, very small, but potentially meaningful, that you could do. And that just gets people thinking, from the beginning about how to actually apply the material, which, can be the best way to kind of maintain those learning gains.
Yeah, exactly. Great. And then sharing opportunities for HOPE with families in and out of the program. So find out what other opportunities there are in the community for families to connect with, building blocks, and make sure that people you're working with, families you're working with, know about them. Maybe it's a neighborhood block party for engagement. Maybe it's a resource on secure housing or food or other basic needs, environment. That HOPE hub that the participant earlier, I've forgotten your name, was mentioning sounds like an amazing resource for the entire community in that sense. And then make sure, you're framing these to families as opportunities to access building blocks, even if it's a referral, kind of framing that referral through the lens of the 4 building blocks and how that service or program or whatever is being offered might create more access to that building block for the family, I think is a great way to, again, connect to the framework.
And I think that segues really beautifully into, Michael, the answer to your question of how do you apply this to those returning from incarceration. I think very similarly to the way we're talking about it. And I think really framing it less as, you haven't worked, and so now we got to try to build a work history for you because you haven't had it. But instead, how might, when have you felt, the most engaged in your community, or what's a community or a group that you have interest in, or what would you like to do? What's a skill that you think you already possess? Tell me a little bit about jobs you've had in the past. Depending on how long they were incarcerated, they may have had jobs, or they may have had roles while incarcerated that might be helpful. And so I think, really all of these things apply, even if your population tends to be, a lot of individuals who are recently released from incarceration. I think you can be looking at forms and asking them in ways that aren't just for people who haven't been incarcerated, right? Such that you have to keep saying, not me, not me, not me, because, you've been incarcerated. Thinking about space and, safety of space and the space that they're used to, and what might feel more comfortable, or what might also feel a little bit scary, and what might feel uncertain. Really framing things through these building blocks and really trying to understand what goes in those buckets. Someone told me recently that when they do Hope 101 trainings, they literally have buckets, like sand buckets, and people write ideas and put them in the buckets to understand what they look like in the community. And I just think that's a really cool way to do it. And I picture that now whenever I say about the buckets, but, really sitting down with somebody and filling up those buckets with things that already apply, or opportunities for them to strengthen that. I think that applies beautifully for people who've been incarcerated. Camille, I don't know if you have any other thoughts.
Yeah, I would just add, we know that if that person who's returning from a period of incarceration is a parent or caregiver, we know that separation from a parent or caregiver is an adverse childhood experience. And so just kind of keeping that in mind in some way, in the sense of, it might be really hard for that person, obviously, to understand, I wasn't there for my child for this experience, or I wasn't able to be involved in the way that I really wanted to as a parent. And so framing any opportunities for them to get connected with parenting groups or other types of opportunities to engage their child through the lens of, look what you are able to do for your child now, I think could be really valuable.
Great. All right. And so, we've been talking about a lot and giving a lot of examples, and just, curious, which of these options feel doable in your current work? Which ones feel challenging? Just thinking about how might the things that Camille was just talking about, how might they apply in your current workspace or your community? And yes, Tara, the same could absolutely be said for a military deployment as well. I think the HOPE framework fits in really beautifully for any parents who have to be apart from their children for any reasons, thinking about other relationships in that child's life, and also finding ways to maintain, that relationship as appropriate with the child's parent as well. So just giving everybody a couple moments to think about things that might feel doable, things that you jotted down that you were like, oh, I could maybe do that. Or maybe that's in line with something we're already doing. Or here are the reasons that would be challenging right now. It feels very simple to just change the focus on the positive. Seems like teens need constant reminders not to inflict more trauma. Yeah, Jill, I think what's so powerful about this framework is really how relatively simple it is, right? We're not asking you to throw out everything you're doing. We're not saying you have to do it this way and it has to look like this. I mean, we're really saying, what else is there that maybe the focus hasn't been on for these families, because so much focus has been on what's not going well, or what they're not doing, or what hasn't happened. I did some work with a group a week or so ago, and we were talking about, when a person needs to get, I was talking with a social services group, and we were talking about when someone needs to get a driver's license, right? And how in a lot of ways it seems really simple, but how many steps really go into that? And how hard it is if you only look at it as you either succeeded or you didn't. You either got the driver's license or you didn't. For a lot of people that I've worked with, it's taken getting a birth certificate, it's taken figuring figuring out how to get that birth certificate. It's getting transportation to get the driver's license. It's all these steps in between. And there's so many opportunities to kind of celebrate resilience and problem solving and promote some of those skills and help people, feel a sense of mastery. And we skip over that so often. Coalition has embraced this framework, which began with intensive work with the Montana Institute. We have a Hope champion at our workplace. We could have her do the 101 training for our tobacco prevention team. Great. Yeah. Changing the how people are interacting with clients and potential clients, even if the program structures aren't hope oriented. If we present the services in a hope informed way, we can start to move the culture and experience. I love that, Miriam.
Yeah.
I spend a lot of time talking with people about, sometimes you can change forms and sometimes you got to work with the forms you got. But I am a firm believer that no matter what, you can make that experience more hope informed. So yeah, if you can change, literal programs and policies and forms, fantastic. Sometimes it takes like an act of Congress for that, depending on how big your organization is. And it's not worth the time or resources. And you can shift lots of the things like you just said and make a huge difference.
Jade says, I think of it as factoring in the attitude of curiosity, what is strong with you, as well as what's wrong. And I ask myself as well on the daily need to practice the reframe. Yes, I absolutely relate to that. And I think that, as is talked about in the Hope 101 training, we are primed to look for risk. We're primed to look for challenges. We're primed to look for problems to solve. So it's an ongoing practice of reframing for ourselves as well.
Yeah. And I think it's the both and, right? It's not saying ignore the challenges, ignore the risks, like not at all. And I think that's powerful. Yeah. Great. All right. So Camille, you want to talk about some of these resources that you have slaved over in recent time?
We got a lot of resources. We're really, again, fortunate to have worked with the Hope National Resource Center on several projects that involved resource development. The first we mentioned, I think at the top of this call. So the Hope and Substance Use Prevention, Intervention, and Treatment is an online training that is free and available through the Hope National Resource Center webpage through I think it's courses tab at the top. Of course, it will be linked here. But this training is intended for anyone who works in the substance use prevention, intervention, or treatment space and helps to consider more of what we've talked about today. The second was not one that I was involved in, but I love, which is 4 ways providers can assess positive childhood experiences. And again, it's a good one if you're looking to incorporate more of an understanding of strengths or PCEs into the intake or treatment process. So check that one out, definitely. And the rest are handouts, both for families and for some are for internal organization use. Some help to explain the 4 building blocks and apply them to the settings where families are receiving programming. And others such as Hope and Strengthening Families Informed Coaching Guide are a great way for that handout in particular is a way for folks who are in supervision or talking with other staff to begin with a conversation about strengths and resilience in the families they're working with and really apply the Hope framework to their own internal processes. So definitely take a look. These are all, again, linked here, but will be, they're available through the Hope webpage as well in the resources section.
Yeah. And I remember when we were working with the National Resource Center to develop these, the goal was to make these really pretty straightforward and accessible. So, with the hope that you click on it and read it and not have to go do all this extra, like research and understanding to be able to start kind of applying some of this work.
Oh, and you put them in the chat. Yeah. Thank you, Amie.
Yeah, no problem. No problem. All right.
So we also have a question.
Go ahead.
can you speak a little about the current research regarding adult positive experiences?
Yes. So great question. And you know what? I can't cite any particular article, but what I do know is that the research, really does suggest that this is not something that you miss a window on. We talk a lot about positive childhood experiences, and obviously the younger and the more of them you can get, the better, but all is not lost if you or someone had less of these in your childhood than you would have liked. The brain is a really, really powerful, adaptable, malleable kind of piece of our body. And what we know is that even for people who who maybe have high ACE scores and low PCE scores, that getting access to healthy relationships, getting access to safe, equitable environments, having a sense of mattering and connection, learning those emotion regulation skills, those can be game changers at any point. And so, like I said, while I don't have an article to cite, for you directly, there's certainly research out there that explicitly talks about this, but also just talks about the power of different therapies and different, approaches to group work and individual work and community work to, reduce some of the, some of the things that we know that are risk factors for substance use and suicidality, connection and belonging being a big one. And so the CDC has some great resources on some programming out there that, has some good evaluation research behind it. Their technical packages specifically talk about some different kind of key elements in suicide prevention work. And this is a component of that, even if it's not named that explicitly. Yeah, there's been some interesting work out there that even just shows some gratitude work and appreciation, recognition of things that are going well, all of those things can really can change, brain structure and promote more positive experiences. Great question. All right. So what we would like to do is give you an opportunity to speak to one another in a breakout room. And we're going to do what's called a 3W. So what, now what? And really the idea here is, again, not just to kind of regurgitate the information, but to really think about what stood out to you and, then apply it. So what stood out to you the most? What would it mean if you could make even one of the changes that we talked about or that you're thinking about? And then what would it take, to actually start doing that? Because again, I think sometimes what we realize is that it actually wouldn't take as much as we thought it would, or, we do have a little bit more access to what we would need to make these changes. So we're going to go ahead and, I'm sorry, I need to cough. I'm going to go on mute for a second, but I'm going to go ahead and get these breakout rooms set up. All right. All right, and I'm going to go ahead and open up those rooms, and we're just going to give everybody about 10 minutes or so to talk through that. There should be about 4 people in each room, and then we'll bring you back and we'll start winding down.
Hi, folks. Welcome back.
Back, everyone. I'm going to go ahead and get my screen shared again here. All right. And so we hope you had a nice chat with whoever you were in your rooms with. And we'd love to hear from anybody who wants to share, what they talked about. No pressure. But...
Hi, I'm Jade, and I can share. just that we were from such different geographies, such different locations, different sectors, but that hope is a framework that can really fit in anywhere. And you can take as much or as little of it. And I think someone just commented that as long as you share it enthusiastically, it's contagious, and people, we can take it and we can use it as much or as little as we want to in our work, wherever we're at. So I love that.
Yeah, I love that too. I mean, it's really built as a strengths-based approach, right? It's not an all or nothing, and I think for anybody who might have been in my session earlier today, when I was talking about the data survey that we just collected on who's doing what, it's fascinating to hear who's doing what. Some people are doing, very beginning steps, one area that they're focused on. Some people are doing all kinds of things all over the place. Some people are a few years in, and it's all valuable. So for sure. Thank you. Anyone else? Give people just another minute or so in case they're typing. You can also feel free to come off mute if you'd prefer. All right, see some connections happening in the chat, which is great. All right. And so, along the lines of what I mentioned earlier, which is really common whenever I do a training or a session, just to get you thinking about something small you could do. And so I'd love for you to just take a moment to think about one small action that you could take next week to begin applying something from today. And if you'd like to share that, you are welcome to in the chat. You don't have to, but just want to give everybody a moment to just kind of think about that. Again, something small, and I'll even add in there, I didn't type it on the screen, but I'll even add in, without any more resource or authority, something you could start doing. All right, Jason said, I'm beginning my Hope Facilitator training on Thursday. Fantastic. Excited to bring this to my community. Wonderful. Congratulations.
And we have a what is strong with you as well in the chat.
Awesome. Yes. Yes. Sprinkle hope showers. I love that. That should be a community messaging campaign. It should. Susan, hop right on that. This week, I will look more for what I do like regarding my teenager's chore and homework ethic. That's great. I will say that this model really has also changed how I parent in a lot of ways, because I find myself really just working hard to hold both, to be frustrated that bed is not made, and to appreciate that my 13-year-old got enough sleep, all right, I can hold both. But I think that is, I always joke that, hope is not a diet, it's a lifestyle. It really is something that if you're going to do it and really, really be able to kind of integrate it into everything that you're doing in home and in your community and at your work, it really is something you have to practice lots. So I love that. I think we need to have a leadership discussion on what peer support program could look like in our school-based health centers. Wonderful. Yeah. And, and something else I want to just point out is, again, I think sometimes when we think about these activities, the end goal is the peer support program, right? But the conversation is a big deal too. So even just to get that discussion going is really powerful and an important first step. Awesome. Hope is a verb. The action brings about hope. Wonderful. I love that. Jade, you have inspired someone to try to do the same with their teenager. Wonderful. I have to share this just because I feel like it's relevant here. And I think one of the reasons I liked it is because my brain is hope, is full of hope always. Someone recently told me that when your kids become teenagers, everyone warns you and tells you how hard it's going to be and all these things. But someone said, they go from being dogs to being cats. And that resonated with me like on the deepest possible level. And I think the reason that I loved it so much is because dogs and cats are wonderful, right? Like we love dogs and we love cats, and some people love dogs more and some people love cats more, but nobody says that cats are awful and dogs are awful, right? And I think even just the framing of teenagers being difficult is really focusing only on, really one side of that coin. I think in the same ways that teenagers can be really difficult, they also can be really fantastic. And so anytime my son like wants nothing to do with me, I'm like, it's just a cat. It's just a cat. But it's a reframe, right? It's a different way to think about it. And it really is more, a much more hopeful approach than just this kid doesn't care about anybody anymore. All the things that you hear about teenagers. And I do a lot of work in my private practice with teenagers, and people are hard on teens. And so I think that's fantastic. Teenagers are cool like cats. Can we spray teens with water when they hiss at us? That's an interesting idea. Yeah. So, again, just a different way to think about, things that I think societally we talk about like it has to be a certain way, right? And it doesn't. And that's true of our, populations that are struggling with substance use, that are struggling with mental health issues, that maybe have recently been incarcerated, who maybe haven't been able to show up in their parenting role in the way that they might have liked or others might have liked. But there are still strengths there to be seen and had and uplifted. And so great. Love some of these ideas. All right. As we wrap up, one thing that we want to make sure that we get to you is our contact information, because we know that this was a lot and your brain might keep working on this information even after the session is over. And so if you have questions or if you have thoughts or ideas, do not hesitate to reach out to us. We actually would love for you to reach out to us and share what you're thinking. We're both, pretty passionate about this work and about this population and about the importance of bringing a hope-informed approach. And so we'd love to hear from you. Camille, any final thoughts?
Just a thanks to everyone. I really loved hearing about your work in the chat. Thanks for coming off mute and putting your comments in the chat today and for being here.
All right. And we will hang on for a couple more minutes in case anybody has any questions. But otherwise, we hope you have a great rest of your day and enjoy the summit tomorrow.
Thank you.
Thank you.
Thank
Have a
you.
good rest of your day.
And I put in the chat, I'll be at the Summer Institute, the Montana Summer Institute. So if you're at the Summer Institute, hit me up.
Look for Terry. Thanks, Terry.
You bet. Bye.
All right. Not seeing any questions, Camille. I think we are probably good to go. So I'm going to go ahead and end the session.
Thanks, Amie.
Thank you. Thanks. Bye. Bye, everyone.